Yeah, it's another good day outside. So I'm out here doing a little reading, breaking out my books. You know, I got a lot of free time since my PS4 burnt up on me, so I can start back rereading these books and actually having a better understanding of some of the things that I do naturally. So these are some good books, you know, especially this one right here. This is the book that I'm reading right now. He's going like a lot of basically like medical massage and things like that. Let me go through. I'm about to read from another excerpt later on in a minute, but I hope my phone don't blow up on me like it did yesterday. But like as you can see, the contents, you know, theory of medical massage. You talk about the neuromater, the reflex within the neuromater, reflex zones, nervous system formations. Actually, what we're gonna read today is the pain evaluations and patterns. You know, medical massage and medical massage concept. I'll be starting this chapter and this chapter. I'll be doing this all next week, so I'm gonna get an early start by starting Friday. But I have until, you know, like next week to get finished. Next Friday, next Sunday to be done. But like, I like this because I mean, it's even a good textbook you can use, even people in school. Which, man, I wish I had this in school. You know. So like even like when I go to the end of my chapters, you know, bang, got my study quest, you know, motor response, you know, reflex zone, particular tissues, reflex zones, particular tissues, things of that nature. So, you know, it talks about the good things, like so I can always test myself. That's what I'm going to be doing. And I'm also, you know, I go to work every day too, so I get to, you know, apply these in practice every single day. So, yeah, so it goes over a lot of good stuff. You know, periodic massage, you know, talks about the segment reflex massage. But also I want to bring awareness too. I want to bring awareness to the massage community because a lot of people don't really have a good awareness of it on what's going on and what really can take place, and you know, so I want to bring another side of information to it also. You know, a lot of good things that's going on. So you know, talk about like a lot of lymphatic drainage, the manipulation system is stretching. You know, the medical massage for disorders of the central and peripheral nervous system. You know, spondylosis, pathological, the cranial peripheral nerves, you know, talk about a lot of like, you know, median nerve neuralgia, predatory syndrome, femoral nerve neuralgia, orbital, you know, a lot of these things that I talk about, you know, like a lot of disorders. Oh god dang, it's windy, like stroke, cerebral palsy, Parkinson's disease. You know, we're not saying this about no carriages. Those things to help you, you know, manage and cope with a lot of things. You know, vertical. They got like a lot of protocol and things of that nature. You know, like a lot of you know trauma and chronic disorders, musculoskeletal system. This is going to be important for me. I can't wait to get to this. You know, rotator cuff syndrome. You know, everybody have these rhomboid issues and things of that nature. The meniscus, sprained ankle. You know, a lot of things like that. Chronic disorder, the musculoskeletal system, osteoarthritis, degenerative joint disease. You know, rheumatoid arthritis. Ooh, I had a lady yesterday with some rheumatoid arthritis. Man, we did some good work on her yesterday. It was real good. I'm proud of what we did with her yesterday. But that was, yeah, it was a tough case because she was so young and I just never seen nothing like that. Somebody so young. But I'm excited what happened yesterday. You know, I have to drop foot as a result of my traumatic brain injury. There's always time. There's always time. There's always time. Like this book, like a lot of things I was looking for, you know, with a lot of stuff I've been looking for, you know, like brain body connection, things of that nature. You know, it's pretty much already in the book. I didn't even know it. I was like pretty much just searching for books. And this book already have it. So like this book, it goes back. I mean, the reflex mechanism is very important in medical massage. So it goes back and like the first 42 pages go back and talk about a lot of things back in this book. Cause I mean that's how important it is. That's what I was reading a lot of these things yesterday to y'all. If you go back and see some of those videos, I'm gonna go read when I do this thing. I'm gonna go read like a certain aspect of certain parts of these videos. Then after that, Alexandra's gonna put them on YouTube, you know, for everybody to look at. But I really think these are very important, you know. So they talk about that. So like, you know, after that, you know, we go over to like the cardiovascular system, you know, massage technique for the cardiovascular system, you know, respiratory system, digestive tract. I say like Crohn's disease, gastric competitive disorder, hepatic and hepatitis, and you know, a lot of these you know, things that we could do. This, man, y'all will be surprised, man. You know, even dealing with the pregnancy. You know, I posted something about breastfeeding for women off this last week, and man, it's some good stuff. It's some real good stuff. So like disorder to the urinary system, medical massage treatment to the chronic disorder. What's up, Zach? Hey, man, hey, I miss Madden, but hey, ever since my PS4 blow up, man, that's what I got to do, man. You know, hopefully I can get back. You know, only get off in that one league, but man, this is my true love. So that was the best thing that happened, because these past 2 years I've been a Madden addict, but now I'm back to what I always do. You know, I gotta get back and learn. You know, learn all this stuff. So yeah, I'm gonna just spend some time reading a lot of these books, and I'll probably take about 2-3 months to read this book, and I just instead continue to go back and use it as a guide and to have a good understanding, because I do a lot of different things anyway. You know, my stuff is so different. You know, I naturally do a lot of things that just naturally reach a lot of attention and just it's going for. You know, I don't know how I tapped into it, so it's pretty good. But anyway, I'm about to go read this pain evaluation. This last part of this chapter, then I can go do my study course at the end, like I like to call my test. I'm gonna do my testing. It's open book test for me, you know. So these are dermatomas right here, you know, the parts of the body, you know, like a lot of nerve innervation, you know, dealing with, you know, the eye, the heart, you know, how they, you know, head to like the C1 to C7, T1 to T12, T9. It's just, you know, so this was like this was like what like a lot of your intestinal, liver, you know, stomach, things of that nature. Up here it's like your thyroid, your heart, your lungs. So it's where it like kind of, you know, innervate from. Hey son. So we talked about this, talked about that. We talked about that yesterday. But let me get back to I started right here, but I'm going to start right here. So this is the pain evaluation and pain patterns. So science understood a little about pain before Professor Melzock and Professor P.K. Wall introduced the gate control theory of pain. We're going to talk about that. I'm going to get my other book and talk about that another time. That's important too. In 1965, this is very important. It's actually in this book right. This is a very important issue for the practitioner. I would like to refer the reader to a separate publication. Therapeutic massage, a scientific approach to where the gate control theory of pain is discussed in details from the medical massage point of view. The general evaluation of pain as a syndrome starts during the patient interview. This gives the practitioner important and valuable. This is a lot of important stuff coming up. Valuable ideas which later can be confirmed during the palpatory examination of the soft tissues. These are several issues regarding pain that the practitioner should consider when interviewing the patient: the onset of the pain, the character of the pain, the type of pain. The pain dependency from movement, the intensity of pain, and let's review their meanings for the medical massage practitioner. Okay, so this is more of the onset of pain right here, fellas, and ladies and gentlemen and whatever else you want to be called. Boy, get out the way. Don't hear that crying you doing. You lucky you're outside playing and having fun. Anyway, if the patient had acute onset of the pain, he or she will always remember it in its circumstance. You know, like if you failed and all of a sudden, bang, such and such, you had that pain, you're going to remember it forever. Anyway, which may be important as well. If the patient says that he was completely well, and when he moved a heavy piece of furniture, he felt acute pain which still bothers him. The practitioner should consider the trauma is the initial cause. In such cases, the local application of medical massage will be much more preferable. In another scenario, the patient may say that he felt acute pain in the early morning when he was getting out of bed. I know a lot of y'all go through that. I've been posting about that for a long time. The pathological outcome of this simple event tells the practitioner that he or she more likely will find the occasional reflex zones in the skeletal muscle. We'll talk about reflex zone. Actually, we talked about that yesterday in the skeletal muscle. This means that as a result of a condition of hyperirritability In the muscle spindle receptors, the threshold of their activation dropped dramatically, and even simple movements after a night's sleep cause their premature activation. As soon as the muscle spindle receptors sent an excessive amount of sensory stimuli, the spinal cord, the lower motor centers evaluated that this input as the alarms responded with the motor command to the affected area, protected by locking the muscles to prevent further damage. In this scenario, the practitioner needs to combine the reflex and the local effects of the medical massage, because the restoration of the threshold of the muscle spindles is the first critical step in the examination of the reflex zones in the skeletal muscle. Like I said, we're going to be put all this back on YouTube so y'all can just go over and re-listen to it, you know. I just want to keep reading because I want to get better at my talk game and my reading game anyway. So that's my weak point. So that's why I'm doing all this. The gradual onset of pain. If the patient does not remember an actual event which preceded the onset of pain and it gradually increased, the practitioner more likely will encounter a case of reflex zones with a gradual decrease of the threshold of the peripheral receptors. In such a case, the practitioner needs to gradually decrease of the threshold of the peripheral receptor. In such a case, the practitioner needs to combine local massage, like in the direct area, and reflex massage. You know, we talked about the reflex, earlier. It's very important. The medical massage. And okay, character of pain. This is more of the sharp pain. There are many sharp pains develops. Recent traumas of the soft tissue, compressions of the spinal nerve, a bulging or herniated intervertebral disc, compression of the peripheral nerve by intense muscles, the acute stage of visceral disorders, active periostal trigger point. We talk about the periostal massage. We're going to talk about that down in other chapters also. Occlusive arterial vascular disorders, decrease in the surrounding temperature, an acute stage of arthritis. Okay, so we're going to talk about the aching pain. Aching pain accompanies hypertonic muscular abnormalities. Active trigger point. Those trigger points. Like when we touch certain areas of the body. Basically, everything can be trigger points. Hypertonus, pretty much the same thing, and myoglosis. Pretty much the same thing. Osteoarthritis, fibromyalgia. Okay, this is more of a burning pain. I know a lot of y'all go through these burning pains. Burning pain is a symptom of irritation or compression of the spinal or peripheral nerve. Cutaneous trigger points, advanced cases of the periostal abnormalities. Example, tennis elbows. When burning pain is felt during rest hours over the part of the body, this is the 100% sign of the I don't know how to pronounce that word. Cutaneous reflex zone. In the case of periostal trigger point, it has a very local and even pinpoint location. So, burning pain is a symptom of irritation or compression of the spinal or peripheral nerve. Cutaneous trigger points. Advanced cases of the periostal abnormalities. An example, tennis elbow. When the burning pain is felt during rest hours over parts of the body, this is a 100% sign of the cutaneous reflex zone. That reflex zone again is very important. In cases of periostal trigger point, it has very local and even pinpoint location. The more the pulsating pain. Pulsating pain is a sign of acute inflammation of the soft tissues or joint, insufficient venous and lymphatic drainage. That's very important. Lymphatic and venous drainage. Example, varicose veins, things of that nature. Okay, so we get the type of pain. Local pain is felt within the border of one anatomical segment of the body. For example, trauma or osteoarthritis. Example of local pain. Radiating pain. The patient feels pain radiating from one area to sometimes distant parts of the body. Pain may radiate alone from an affected nerve or from active trigger points in the skeletal muscles along the fibers of. All right, y'all. I'm about to continue from earlier. Remember, it kind of got disconnected. So where we was at was at the pulsating pain, or we had just finished the pulsating pain. Pulsating pain is a sign of acute inflammation of the soft tissues or joint or insufficient venous and lymphatic drainage. Local pain is felt within the borders of one anatomical segment of the body. For example, trauma or osteoarthritis or examples of local pain. Radiating pain, actually we read this, but we're going to keep reading it again. So, the radiating pain, the patient feels pain radiating from one area to sometimes distant parts of the body. Pain may radiate along an affected nerve or from an active trigger point in the skeletal muscles along the fibers of the same muscle and entire muscular group. The pain from the active periostal trigger points may radiate into the joints. So this is where we was at before it shut off early from the other video. So this is more of a continuation. I want to be outside, but my phone keeps shutting off. When I don't have it hooked up to the battery charger. I don't know what it is with the phone and Facebook Live. I guess it's time to get a new phone. Visceral pain. No, spreading pain. The best example of spreading pain is fibromyalgia. Initially, it affects one area of the body. With time, it engulfs in neighboring areas, and later, new focal pain appear in the distant parts of the body. So this is more of my medical massage books I'm reading from. So this is dealing from things looking at from the massage point of view. Dang, it's not even. Oh man, well, god dang it. Hold on, let me look at it this way. I don't know. I hope y'all can see it. I don't know, man. I'm trying to get it to where it zoom in pretty good. Anyway, I'm reading, so it don't matter. Visceral pain is a low-grade pain. Is a low-grade and purely localized type of pain. However, in some cases, it can be very strong and acute. Example: the kidneys and the colic. In the majority of cases where the patient feels the pain is not its actual origin. The spreading character of the visceral pain makes it difficult to evaluate. Yeah, man, the visceral pain is crucial, man. So, I mean, you can feel like, you can have like visceral pain in your stomach, but feel like in your, in the middle of your back, in the upper left side of your shoulder area, along the clavicle line. So, man, it gets crucial, and it can manifest, in skin issues, tight muscles, things of that nature. Now, it's as effective for all types of, other parts of the body, so it's crazy. One of the major signs of visceral pain in this correlation with one of the several autonomic reactions, such as a headache, nausea, vomiting, profuse sweating, coldness, and paleness of the skin. Referred pain is the best result of reflection of visceral pain of the somatic structures with which shares the same innervation of the effect as the affected inner organ, head zones, Chapman reflexes, Glitzer zones. In cases of chronic visceral disorders are very good examples of referred pain. So let's go back and look at referred pain again. I feel it's important. Oh man, I don't know what the hell, why it's not zooming good. Yeah, it's time for a new phone, I guess. I don't want to get one because it's stupid getting phones. But referred pain is the result of the reflection of visceral pain on the somatic structure which share the same innervation as the affected inner organ. Head zones, Chapman reflexes, Glitzer zones, in cases of chronic visceral disorders are very good examples of referred pain. So you can do a good job of, especially the Chapman reflexes of seeing what's going on in the body. They tell you a lot of things early. The type of pain. Come on, why is this? I have no idea. Y'all gotta forgive me. People don't want to look at these words like this. I don't want to cut it short either. In the majority of cases, the pain in the morning is a sign of abnormalities of the musculoskeletal system. Y'all know how that goes in the morning when you wake up with all those issues. Regular muscular contractions are one of the driving forces of the peripheral circulation in the soft tissues, including the muscles themselves. During the night, the muscles work less, and the muscle pump does not enforce peripheral circulation. If a skeletal muscle initially carries hypertonic muscular abnormalities, the tension within the affected muscle increases, peripheral vascular resistance and blood perfusion decreases. As a result, the patient feels the pain and stiffness in the morning, and sometimes it takes a couple of hours to reduce the intensity to a comfortable level. As soon as the repetitive muscular contraction restores the function of the muscle pump, the intensity of the pain subsides. The greatest example of morning pain and stiffness or hypertonic muscular abnormalities or osteoarthritis. So I'm about to go back and read this again. I'm gonna give you an example. I was telling before I even read this, I forgot I read this, but I was telling this one guy, who I work with also. I was trying to, he really didn't understand what I was saying, so it just didn't ring a bell with him. He just didn't understand, but it's okay. So like in the majority of cases, pain in the morning is a sign of abnormalities of the musculoskeletal system. Regular muscular contractions are one of the driving forces of the peripheral circulation in the soft tissues, including the muscles themselves. Okay, during the night, muscles work less, and the muscle pump does not enforce the peripheral circulation. Among the peripherals, like peripheral, outside the central nervous system, like going down to the arms, the legs, things of that nature, so peripheral. In the skeletal muscle, if the skeletal muscle initially carries hypertonic muscular abnormality, the tension within the affected muscle. If a skeletal muscle initially carries hypertonic muscular abnormalities, the tension within the affected muscle increases, peripheral vascular resistance and blood perfusion decrease. As a result, the patient feels pain and stiffness in the morning. That's why you shouldn't really eat late at nighttime. Fruit. But if you do, like I say, your body's not gonna. Cause at nighttime when you sleep, as you see, just read this little excerpt. The body wants to concentrate on the inner organs and things of that nature. And if you're eating, it's gonna be tough to digest that food and do what it needs to do. So you're also gonna have blood going to all parts of the body. But it's not going to be able to reach those parts of the body if you are just eating, because it's really going to have to direct all that energy in that digestive tract. So it can be tough, right? It can really be tough. But as soon as repetitive muscular contractions and restore the function of the muscle pump, the intensity of the pain subsides. The greatest example of morning pain and stiffness is hypertonic and muscular abnormalities of osteoarthritis. So we're going to talk about late afternoon and evening pain. The patient wakes up with or without the pain very mild. Later during the day, he or she starts to feel pain, which increases with every hour and reaches the maximum in the evening. Now, this is a lot of people we know. Most likely, the patient suffers from intervertebral disc pathology, a bulging disc, or tension in the soft tissues within a vertebral segments reached some critical level, and it started to affect the distribution of the vertical load within the vertebral segment. In such cases, vertical position of the body increases the pressure on the affected disc or within the vertebral segment within the following irritation or compression of the spinal nerve. For these patients, sleep night brings pain relief because it unloads the vertebral segment and intervertebral disc. Remember, this is more of my this is coming from the perspective of through medical massage, through my do a massage approach to things. So this is my massage book. So I'm just wanting to just bring more awareness, to others and such things. Oh, there we go. Any type of pain at night, any type of chronic. Now remember, we're talking about the pain at night now. This is not 100%. This is, through their perspective, through their research and what they found. So this is not like 100% tell all be all, But this is very powerful. Actually, doctors need to get a hold of this book, to be honest, because they can learn a lot. I'm talking about a lot of work they put out there. But this is pain at night. Any type of chronic or visceral disorder may trigger pain at night. Repeat that again. Any type of chronic or visceral disorder may trigger pain at night. Usually, it is a sign that the practitioner will encounter a difficult case. The parasympathetic nervous system is much more active during the night. When the parasympathetic nervous system, it's going to focus a lot more on the colon, the stomach, things of that nature, the lungs, well, not the lungs, but the colon, the stomach, the liver, the gallbladder, things of that nature. So we want to, send the energy to that area. It's much more active during the night with the majority of the pain stimuli using its pathways. This is why pain, which may be tolerable during the day, feels excruciating at nighttime. So there you go, man. Dealing with a lot of visceral organs. Visceral is like like we're talking about the stomach. Deep into the nervous system, the colons, the liver, things. That's what we're talking about. The visceral organs. Visceral means deep within for the most part, but this is more the visceral organs. Trying not to make sure this thing don't blow off on me again. Correlations of pain with movement. Pain increases with movement. The intensity of pain always increases when the patient has an active trigger point. We know what the trigger points are. We talked about that before. In the skeletal muscle and the periosteum. Another scenario is radiating pain along the pathway of the peripheral nerve. In such cases, the contraction of the already tense skeletal muscles additionally irritates the already affected nerve and triggers radiating pain. This is a very helpful symptom because the practitioner will get an exact idea what muscle on what level affects the nerve by asking the patient to execute movement which will triggers radiating pain. Movement in the joint affected by the contractor may also trigger pain. Boy, that boy Rip Jr. is just crying. Pain decreases with movement. And see, this is what I do a lot of, what I used to always talk about my facilitated spontaneous yoga. I do a lot of things where we can actually, I don't know how I was able to just tap into people's bodies and sync with them. But I do a lot of things where we can just move the body, stretch the body, such things like that, where it actually decrease pain with movement, whether it's through static movement, yoga, so for the facilitated spontaneous yoga, things like that. So I do a pretty good job of that. I've only been doing it a year and a half. It's kind of like, God just gave this to me. Pain decreases with movement. When the patient has pain as a result of edema, it decreases. When the patient has pain as a result of edema, decrease of circulation, sleeping trigger points, or inactive myoglosis, repetitive movements bring some decrease of its intensity as a result of additional active of the muscle pump, which increases arterial circulation as well as venous and lymphatic drainage. And that's quite understandable. Little small movements. I'm always talking about little small movements. Just small movements. Just stay active. Just move. Movement does not have an effect on the intensity of pain. Pain in areas of cutaneous trigger points or referred pain are examples of this. Intensity of pain. Professor Maslow, one of the fathers of the gate control theory, proposed the graduation of the intensity of pain on a scale from 1 to 10. Let me see. This may be This may be it with the chapter. Now I'm about to do my my homework. Okay, yeah, I'm about to do my homework, and I'm done. I can take a day break. These spins, squats, jacks in the morning doing. Oh, hey, they are Pierce. Give me a few more weeks. I got something else for you. Me and my wife been doing it too. I've been doing it. I do it every once in a while, but give me a few more weeks and I got something else I want to bring to the public, and it's going to help with your digestive system. It's going to help with your ability to breathe a whole lot more effectively in the morning times. You just have a whole lot more energy, and your dreams should really increase too. This is something I've been doing the past few weeks, but I just want to experience it for myself for a little while. But I think it's going to really be good. This only been short term, so I really don't want to talk about it yet, but I want to at least give it a month or two before I really talk about it. But I think it's something that's going to be very powerful. And it only takes 5 minutes. So I'll talk more about that another time. But anyway, I'm going to talk about this pain pattern. This is the last part of the chapter. I finally finished reading this first chapter 1. I'm about to go do my homework after this. Well, this is for myself. I don't have to turn it into nobody. But I want to make sure I understand a whole lot more. Okay. To increase practical value of both volumes. This is volume 2 right here. It's a good book. Volumes medical massage textbooks and make an application of medical massage protocols. Easy. I arranged the most common pain patterns on diaphragms and correlated them with the discussed treatment protocols in figure 14 through 21. Figure 14 through 21. Okay, yeah, all these right here. I guess we really won't have time. We do have time. These diagrams reflect different locations of the pain in references to somatic or visceral abnormalities discussed both in both volumes. Man, volume 2 is powerful. I did not know how powerful volume 2 was, so I just happened to look at it. And it's really, and the thing about this is, it's going to help me understand my things with my movements I'm always talking about, which some things that I didn't know dealing with the visceral organs. It makes a whole lot more sense. I've already seen some improvement through my nutrition, through my breath work. I mean, this is powerful. It's a lot about massage, but still it helps in so many aspects of my other life. And I'm going to help bring awareness. That's going to be my main goal. I'm going to be putting all this on YouTube and doing a lot of things with massage. I'm going to help bring a lot of awareness to massage too, just like everybody else is doing it. That's something that I want to do too. So I want to bring, because people just not getting these work. And people look at massages, they might get like 1 or 2 massages a month and think, hey, everything's going to be okay. No. We can't look at massage like that, man. We got to look at massage like like when people go like the chiropractor or physical therapist. Can you imagine if you was able to use your insurance and get like 12 to 15 massage sessions a month for certain issues, just like people go to like the physical therapy? Man, the game would change. We talking the game would seriously change. Just think how a lot of people feel when they just go get 1 massage session. And that might feel good for a few days, they might come back, but imagine you got like done like 12 to 15 times, and then all of a sudden you came back, and you feel, and then all of a sudden you're going to keep getting better, because you're going to keep removing loads and loads and loads of waste. And now your nerve energy is going to, and your energy is going to be directed to different parts of the body, so your body can really self-heal itself. So I'm like, man, if you can like really get like 12 to 15 sessions, like you do physical therapy, it's going to be a great difference. Because I always say it should always be massage before anything else, before you go to physical therapy, chiropractic. That's just my thought. That's just my thought on the thing. It's powerful too, because, the massage is going to help you relax and, release waste and help the body rebuild itself. And the physical therapy is going to help strengthen you. So we can work hand in hand with each other, man. It's very powerful. Bet I can say that we've done them 100% every day, but about 5 days, and I wake up quick. I feel the circulation and get warm. All my dreams been off. Yeah, man, it's crazy, man. Can you read the line on the synaptics? Oh man, I don't even know what the synaptics was. What is synaptics? What do you mean synaptics? Where is synaptics at? Synaptics where? I don't even see nothing about no synaptics. Well, I'm just going to keep reading, and you just tell me what you mean by synaptics. Because I don't see no synaptics over here. But anyway, to increase the product, oh, what was it? Okay, these diaphragms reflect different locations of pains, and I recall you reading something on the last page when the head, I thought you said synaptics. It's basically the shape water you take through vibration. No, I didn't. Man, I have to go back and not in this book. Not in this book. It was nothing about that. Take on the shape water, take through vibration. Not. It must have been something else. I don't know, but I can always go back and. Oh, that was probably one of my. That's probably something else. Maybe not in this book, but it might have been something else. So I really don't know. But don't worry, because I'm about to be doing a whole bunch of reading now. I'm not no video game junkie anymore. My PS4 blew up, so it was on the page with the guy head. Probably misheard. Oh, okay, with the guy head. Talking about this right here? This page right here? Okay, anyway, we'll just... It was on the page with the guy head. Okay, I'll just go back and read everything. Okay, any type of chronic or visceral disorder may trigger pain at night. Usually, it is a sign that the practitioner will encounter no sweat. Okay, yeah. The practitioner will encounter a difficult case in the parasympathetic nervous system. Is much more active during the night with the majority of the pain stimuli using its pathways. This is why pain, which may be tolerable during the day, feels excruciating at nighttime. Yeah, so the visceral organs are important, y'all, man. And a lot of times we don't even notice it, but it's reflecting a lot of pain all throughout the body. You know, I don't care if it's a tight hamstring, a bad back. A lot of times these pains are coming from our organs, and they're reaching to us for information. Hey, they try to give us a warning, but when I get to this book right here, that's going to break it down a whole lot more. Okay, maybe we'll talk about the pain decreases with movement. Let's see. When a patient has pain as a result of edema, decreases circulation, sleeping trigger points or points in active myelinosis, repetitive movements bring some of the decreasing of its intensity as a result of additional activation of the muscle pump, which increases the arterial circulation as well as the venous and lymphatic drain. That's why I'm glad that I do what I do with my movement. It's in the paragraph you're reading somewhere. I know, huh? Pain in the areas is no. Okay, pain. Let's look at pain increases with movement. Pain increases with movement. The intensity of pain always increases when the patient has an active trigger point in its skeletal muscle in periostum. Another scenario is radiating pain along the pathway of the peripheral nerve. In such cases, the contraction of the already tense skeletal muscle additionally irritates the already effective nerve and the trigger point, the trigger radiating pain. This is a very helpful symptom because the practitioner will get the exact idea of what muscle on what level affects the nerve by asking the patient to execute movement with triggers radiating pain. Movement in the joint affected by the contractor may also trigger pain. Alright, let me go back to what I was doing right here. Okay. This diagram affects the location of the pain of the somatic or visceral abnormality discussed in both volumes, which may be responsible for the pain in the parts of the body. To use this diagram efficiently, detect the source of the pain and correlate. This is not 100%. This is kind of what they found in their practice in over hundreds and hundreds of years with over hundreds and thousands of therapists. They just each put out the correlations to get them things that way. So it's not 100%. It's kind of what they found through their perspective in their research on massage. The possible causes of pain in this part of the body are represented under each diagram. The index at the end of each volume will guide you to the pages where each abnormalities is discussed. Read clinical signs. The description of the diagnostic evaluation of the soft tissues and the special test to find out what abnormality the patient has, and the formulate the medical massage protocol. Y'all, but the good thing about this is, y'all know about Dr. Africa. He has a book, a diagnostic book, and I bought that book about 3 or 4 years ago, and that was a powerful book. I'm talking powerful book. I went through the whole entire book. I really didn't understand it. Now I'm about to go back and break that book out, and I'm going to correlate these two books. I'm going to add it with his book, along with some other books. I'm just going to put some things together. So this is why I always just buy random books. Like this was kind of a random books too. I just buy random books because I know everybody's from all over different parts of the world, but you can put things together and it's going to be powerful. So I'm going to break out my old Dr. Africa book, his diagnostic book, and that's one of the most powerful books I read for diagnostic, dealing with the body. And I could put those diagnostic books together, and man, I'm going to come across some crazy things. So I hope that sending the reader to the particular chapters of volume 1 or 2 will save the practitioner time and make clinical things, blah, 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 blah. So I don't really need to read that. So let's just look at some examples. I talked about this yesterday. The deltoid, where you at? Okay, you see deltoid syndrome right there. Anterior scalenes syndrome. These things that they all correlate with each other. Axillary nerve neuralgia, pectoralis minor syndrome, and osteoarthritis and rheumatoid arthritis. These things kind of correlate with each other. Let's look at the. We talked about the sacroiliacs yesterday. Disorders of the large intestines. You see how the sacroiliacs have this disorder of the large intestine and the female genital disorder. So those things have a lot of things in common. Same thing with the ilio-Soha syndrome. You have the lumbalgia, the quadratus syndrome. Those things correlate together, and the urinary system syndrome. These things correlate big time together. So. Yeah, man. So it's kind of what I'm just, I'm glad I got these books. I'm glad my PS4 died on me. Yes, this is a lot of good things. I'm excited about this book. A lot of good things are gonna happen. I'm gonna quote all this stuff is just adding on to the things that I already do naturally. So I'm just gonna add these on. That's why I'm excited. I feel 2017 is gonna be a good year. I'm excited. So, hey man, I'm just happy, man. It sounded like these. I just be talking a lot of times. I think I misheard it, but I got this lined up. I'm gonna check it out. I gotta check it out. But yeah, so I'm excited. So I'm done reading. So my whole chapter is done. Next week, I don't know what I'll probably read y'all, but this is more about the methods of medical massage. Medical massage concept, a place of medical massage in modern medicine. So I'll probably just read some of these next week. As you can see, bang, bang, bang. Connective tissue massage, which is very powerful. The connective tissue protocol. So these are just like these things. And the thing about it, a lot of these things come from Russia, y'all. Russians, people over there, they've done a lot of work on. Of course, I would love to. See what's going on over there in the country that we call Africa, but I don't have that information over there. But hey, maybe I got it internally. But hey, maybe we know where they got the information from, so we don't know. But it's cool though, man. But this is a lot of good stuff, a lot of good information. So I'll be reading it. Then this will be all next week. The segmented reflex. I can't wait to get to chapter 3. The segmented reflex massage. As you can see, all these different the reflex massaging things. So next week is gonna be crucial, y'all. I'm gonna be having a lot of fun next week. A lot of fun. So I can't wait. So this is pretty much it. The kids been doing homeschooling. They taking a break. They about to go to the park. They about to have some fun, run around. Things like that. So yeah, I'm about to be out. I guess I'll go do some other things. Hopefully I can keep doing a whole bunch more videos. I might be one of those guys who do like 2,000-3,000 videos on Facebook, not Facebook, but YouTube now. So we're gonna see what we can do. But anyway, I'm out. Y'all be easy, have a good day, and enjoy that sun. Get some sun. All right.